Well, good morning, everyone. I really appreciate the opportunity to come back to my home state of Ohio. I was born and raised in Toledo. Yeah, as you heard, I've got a little bit of background. You can actually see it back there on the wall too, as well. Did most of my education in Ohio as well. It's fun to come back, even if it is just virtual. But of course, we're doing almost everything other than some of our patient care virtually these days. And before I get started with my remarks, I would just like to take a moment to say thank you to so many of you who've made sacrifices and to those of you who are in clinical settings and all of your clinical colleagues. So many have sacrificed so much this year, whether it's changing the way we work, our budgets, making a sacrifice on the front line, getting sick ourselves, or taking on the financial demands, the furloughs and things like that have come about by way of this pandemic. I thank you. I really, it's been an honor to be a very small part of some of your organization's response to this pandemic, and I'm really grateful and encouraged as we look forward to see what kind of a world we can create and what we'll do moving forward. And so
Hey Justin, if you mind if I do a quick formal introduction?
Oh wait, I didn't know you'd. I thought you already introduced me. Go.
No, you're good. You're good.
That's what happens when I get out of sync and think I'm trying to catch up. Please go ahead.
No, you're all right. You're all right. All right. So for our audience, just want to make sure everybody gets a chance to our esteemed colleague who is joining us this morning, all the way from the western suburbs of Chicago. And Justin, you and I probably should catch up at some point because I did the opposite. So the Ohio State Northwestern thing was the reverse for me.
Nice.
So Mr. Justin Gernot leads the business development, marketing, and operations for Healthbox, who is a HIMSS solution, which provides innovative services to healthcare organizations. Prior to joining Healthbox in 2017, Justin held sales and management roles with GE Healthcare, SG2, Intuitive Surgical, and Dell EMC, where he introduced new clinical technologies, engaged provider leaders to create new service lines, and led the commercial efforts around new clinical, business, and IT strategies. Justin holds a Bachelor of Science in Mechanical Engineering from The Ohio State University and an MBA from Northwestern's Kellogg Graduate School of Management with concentrations in finance and marketing. As a HIMSS fellow, he is active in thought leadership for the community and is a frequent speaker and moderator at industry events like this. Again, Mr. Gernot, thank you for joining us this morning. Now I'll turn it over to you.
Awesome. Thank you. My pleasure. I thought we were way ahead instead of just 2 minutes ahead. All right. Thank you all. It is great to be back here. I will share my screen and the, actually, can you enable screen sharing? Either whoever, Alex, if you're the host. What I prepared today is really more commentary, looking way into the future, looking at where we're at right now and looking a bit into the future about how we want to be remembered by our kids and our grandkids. And there will be conversations, just like there were conversations around, what our parents and grandparents did at critical moments in history. There will be folks looking back, including the ones who we brought into the world. And so I really wanted to structure this more as a conversation. I've got a lot to share, but I'm really interested in what all of you have. I'm interested in your perspectives, your questions, your input. So what I'm going to take a moment here, if I can get my slideshow to turn on here. For those of you familiar with live audience polling, we're going to do that with a few questions today. Please go to slido.com. and enter 22346. I'll stay on this screen for just a minute or two so that everyone has a chance to do this. If your laptop's tied up like mine is right now, you can do it on your phone. It works out great. And also, if you want to connect with me and with Healthbox, we're easy to find on everywhere on the internet, right? We're on Twitter, we're on LinkedIn. Please do reach out, please do connect. I love building more relationships back in my home state and everywhere else. So as we think, when Ajay Sharma, who's gotten to be a great friend over the last couple of years, when he reached out to me and asked me to come speak, he had this great idea about trying to pull us out of our current pandemic mindset and to look back from, say, 30, 40, 50 years from now at 2020 and to think about all right, what would we want to have done? How would we want to have acted? What would we have wanted to do to bring us forward? And I said, wow, that you really captured my imagination. I mean, first, thank you for pulling me out of my day to day, because the day to day is challenging for all of us. But that is such a fascinating question and a great way to frame the challenges that we're all facing right now. And so I started in that by kind of looking backwards. I thought back to my grandparents and great grandparents' stories from the 1940s, from World War II, because that was the last massive challenge that the world faced on this kind of a level. It was very different, but also very deadly and really transformative to every bit of our life. And so, regardless of what age you were, and during World War II, you either went to war, you went to work for the first time, or you supported the war effort. And my grandparents and great grandparents, they had all moved from the coal mines in West Virginia and Pennsylvania to Cleveland to take factory jobs in the 20s and 30s. The Great Depression was exceedingly tough on them, and things kind of went from bad to worse in World War II. My grandfather had just turned 17 when he forged his father's signature to join the Navy, and went to fight in the South Pacific. My other grandfather also fought in the South Pacific. They were both wounded and saw quite a bit of action, and they carried that trauma forward in their lives, and it certainly was challenging. One of my great grandmothers, of whom I'm immensely proud, was a single mother in the 20s and in the 30s, at a time when that wasn't really feasible, and she worked her way up from doing laundry for professors and physicians in Cleveland's Murray Hill neighborhood, which is right by University Hospitals and Cleveland Clinic, to ultimately getting a job in Roosevelt's WPA. And then her final job, which she held for decades, was as a drill press operator at TAPCO, the TAPCO Corporation. And she actually got that job before the war started. I have no idea how she did it, but I really admire those generations and the grit and determination and the work ethic that they had. So when my grandfather and his four brothers all returned from the war, they came back to really a pretty good situation, certainly relative to the war, but they all took jobs in the factories that were expanding or starting to support the rebuilding of the entire world. And that rebuild went exceedingly well. By the 1960s, my grandfather moved to the suburbs. He bought one of the first Mustangs, although it was not a GT350, it was a red convertible, so it's still doing well. And one of the first color TVs. And America was also leading with technology and with societal change, really making good on the promise that we'd always had as a free society. And we led the world in so many ways. My parents were the first to grow up without the fear of things like polio. And so if we broaden that out a little bit and consider the achievements since the 40s, it's been dramatic. There's never been, and perhaps never will be again, an improvement in the quality of life across so many measures as we've seen since then. You'll see that extreme poverty, we've gone from roughly 70% of the world in extreme poverty to just 10% of the world in these last 80 years. Basic education has effectively doubled. Literacy has more than doubled. And if we think about democratic and free societies, only 10% of the world lived like that in 1940, and now it's the majority. Vaccination wasn't even a thing in 1940s. And now we're at a point where not only is the majority of the world vaccinated against major diseases, we can now fast track vaccination. And we're going to see a very dramatic turnaround of this pandemic, hopefully in just a few short months. Child mortality, we will never see an improvement like this again. It's just dramatic. Yet if you ask people today, if the world is getting better, 9 out of 10 people will say it's not. We're not terribly data driven in our decisions and in the ways that we evaluate and make choices about our lives. We're not wired that way. Certainly the media and other sources would do well by keeping us focused on the negatives in this world, but we cannot draw any other conclusion as folks who work in healthcare, as folks who really believe in and rest on technology, that we have engineered through changes in society, changes in technology, changes in process, improvements in overall world safety. We have created a better world since 1940. And we should be very proud for whatever roles that any of us and our family members and folks who came before us played in that. But that brings us today. We've gone from worldwide war to worldwide pandemic. Just as we're inundated with political headlines right now, we've been inundated with Corona headlines, and almost everything we do every day has changed dramatically because of the coronavirus. In the worst cases, we've been impacted personally. We've lost loved ones. In the best cases, we're trying to figure out how to manage children who are doing school from home. They're still in school, but we're trying to figure out how to do that remotely. But fundamentally, the world was just unprepared. We were unprepared, and it really exposed here in the U.S. the flaws of a decentralized private health system. Now, keep in mind, I'm not stating that the U.S.'s health system is not the envy of the world. In so many ways, it is. But when it comes time to have a unified approach to something as pervasive and as a pandemic like this, we were just in a bad way. And while globalization has helped us and all those and so many of those measures that I showed in the prior page, sometimes it hurts, particularly when we're dealing with other countries that lack the trust and the transparency that frankly we hold dear. So where do we go from here? That's a big question. Not one that we're going to totally answer today, but we won't necessarily totally answer it today. But one that is a really interesting one to think through as we think beyond just the next few months. And so as I think about where we go, I want to characterize who we are as an organization. We're all a part of HIMSS. You've all joined this this meeting today. I presume you joined others. And I want you to consider for a moment who HIMSS is. And there are a lot of numbers here. Some you might be familiar with. 80,000 individual members. I'm sure many of you are. Organizational affiliates is all the health systems that are part of HIMSS. There are 480, and I'm sure many of you are corporate members for the organizational affiliates. But we're coming up on nearly 1 billion patients every year who are treated in health systems and provider organizations that participate in HIMSS analytics, that use the maturity models, that have learned that have taken the guidance of HIMSS on how to do analytics and how to use their EMR and how to improve their supply chain in really critical ways that are so necessary during routine times, but even more necessary during the pandemic. And so as big a voice as HIMSS has here in the US, HIMSS is one of many, many associations. The US has a proliferation of professional associations that are clinical and technical and otherwise, the likes of which other countries just don't have. And so when we get into Europe and Asia and the Middle East, HIMSS is incredibly influential. HIMSS is a key trusted partner to ministries of health and organizations like the NHS in the UK. HIMSS has a big impact here, but an even bigger one elsewhere. And there's 3 things we do, right? We do thought leadership, we do social networking, we do professional development. We do this, or personal and professional development. We do this exceedingly well, and they're so critical. And it's one or more of those reasons brought you here today. And then just a bit about Healthbox, the business unit of which I'm a part. We've been a part of HIMSS for 2.5 years. We were acquired. We were one of the first major decisions that the CEO Hal Wolf made after he took the position. And what we do is we provide innovation services and digital strategy development and execution for healthcare organizations. Probably 2/3 of the organizations we work with are health systems. So we do everything from helping to start or reevaluate and redirect innovation programs. We're helping with more and more organizations that want to commercialize intellectual property or things that they've created. Everything from education to devices to software. We do quite a bit of strategy work, both innovation program strategy as well as digital strategy. We do a lot of that in partnership with HIMSS Analytics. We do solution sourcing and have done this for a long time. We originally started as an accelerator. We were the 3rd ever digital health accelerator focused on the healthcare provider market. And our investment team, which you'll see off to the right there, strategic investing is the last thing we do. our investment team looks at between 600 and 700 companies every year in digital health. And prior to our current fund, which we manage for DaVita, which is the world's leader in kidney care and dialysis, we manage the Strategic Investment Fund for Intermountain Healthcare. So a really strong team and a lot of expertise that we're able to leverage. So from that position, once the global conference was canceled and there's so many changes came with the pandemic, we decided we should make some predictions. We decided we should start getting focused on the future. Just as Ajay asked me to look way into the future, we said, okay, let's look to the next few years while we're in the pandemic and when we're out of the pandemic. And it's interesting to take an early look here. We made some predictions for during the pandemic. The first thing we said is consolidation is going to be accelerated. This is an opportunity for the big to get bigger. And we've seen some big mergers or acquisitions be attempted, such as between Advocate Aurora and Beaumont, which ultimately decided it was a little too tough to get that one done. But I do think Intermountain and Sanford are a really good fit, and I would expect to see them, that merger be completed before too long. We also said that agility will no longer be a nice to have. And who among you hasn't noticed the parts of your organizations that aren't agile in these last few months? If it's not agile, it just doesn't get done. It gets thrown out. It gets re-engineered. It gets ignored. Have you noticed too in the hospitals and health systems, the war rooms and the daily huddles? Some of these things were happening in small parts of the organization, or maybe for an EHR go live or something like that. But we're doing that now routinely. Those are the hallmarks of working in an agile way. We're part of a big project within HIMSS right now that's being run in an agile way. It is fascinating how much work you can get done quickly and how many decisions you can make if you're really committed to that. We also said that telemedicine super usage was going to go way up, and it was going to tip a long line of dominoes, meaning that telemedicine was going to really be that big crack that starts to fundamentally change the way that all the key stakeholders interact in healthcare delivery. While we've seen telemedicine go up and then come back down, not only is it not going away, we expect it to go back up again. And I'd be really curious to hear as we get into some of the Q&A what many of you think about that. Shift to value-based payments certainly hit a speed bump. We're not really changing too much the way payment is done right now, but it's going to come back in a big way, probably in an accelerated way, and perhaps with reference to the final prediction we made about emerging care and coverage models. We expect there to be some innovation and some changes there. There've been a lot of lessons learned, a lot of areas of opportunity, and frankly, on the part of even the most conservative and traditional stakeholders, real willingness to change and disrupt ourselves and do things a bit differently. We also made predictions for after the pandemic. So after things were done, what would happen in those next few years after the pandemic? We really believe that consumer expectations will not only shift for the worse, consumers in a lot of cases will continue to avoid hospitals. We already know that to the extent that we could, certainly payment has driven some of this, but consumer expectations, they don't want to be in that acute care setting. And that's going to be supported by these new entrants who are certainly very much emboldened. We've seen Amazon, Walmart, CVS, Walgreens, others have all doubled down on care delivery. And we expect them to be a provider of choice in rural and other underserved areas that were really hit hard by the pandemic and economically had a hard time coming back. No surprise, cash is king. That's always the case, but even more so in times like these. If you can secure a loan, you can do a lot of things. And there won't be as many organizations that will be able to secure a loan or have an attractive cost of capital moving forward. So we expect that this supports the large players, the cash-rich players, continuing to get big. Pandemic preparedness, innovation, and supply chain. We already have more PPE available now than we did in the spring, but we're not yet at a point where we can deploy it smartly. That will certainly change. There's huge investment, significant research being done at the federal level in the US, Canada, and many other countries because we realize what an incredible shortfall that was. Supply chain has for so long been seen as a cost to be minimized rather than a strategic asset to be leveraged. For some of you, IT was not unlike that in some organizations not too many years ago. And we've seen what happened when you're on the wrong side of seeing those assets as strategic or sort of a necessary evil. Social determinants. This is coming to the fore in a very big way. I'll talk a little bit about it later on, but we've created a partnership with Parkland Center for Clinical Innovation down in Dallas around social determinants. Every large system that we talk to says now is the time for social determinants, and they're leaning into social determinants programs in big ways because they recognize the societal impact, but they also know that that no other organization is going to take that on and take on a leadership role like that, other than the largest provider in a particular area. And then finally, and I'm not going to get political on this at all. We do expect, regardless of what happens with the elections and for president or Senate or any place else, the universal coverage debate is going to continue. That's not going away. But I'm hopeful because I tend to be an optimist, and I do think that the arc of our society continues to go up despite all kinds of challenges and setbacks. I do think there's an opportunity to strike a bipartisan deal at some point that citizens will also support. Everyone has healthcare on their mind. Everyone's going to be really nervous to look back at 2020 and see how much they spent and how much it's costing and how little money they have to spend on healthcare. So no predictions there, but we think that debate's going to continue. So with that, I'm going to get into the first of our live polls, and forgive me as I switch screens to support that. I hope you're on Slido, and I will go ahead and start this poll. And actually, you know what? Let me remind, for those of you who weren't on earlier, let me go back to that slide and just remind you which number or how to log in there. So give me just a moment here. All right, so if you go to slido.com, that's SLIDO, and enter 22346, that's 22346, you will be able to join the poll. All right, so let's run the first poll. And the question is, where did healthcare fail during the pandemic? Where did healthcare fail during the pandemic? I've just launched the poll. Please go ahead and start entering your answers. And just like the results in Georgia and Pennsylvania, we'll all watch them come in. Preparedness, data sharing. All right, not too surprising either one of those. Testing capacity. That is a big one, isn't it? Equity, coordinated national response, communication. Preparedness again. Focus on healthcare workers, stockpiles, no question. Lack of supply chain, quality testing, communication. Yep. Again, we come back to data. So I think these are interesting. I want to comment on, it's certainly very interesting, not surprising. I want to comment on a few of these. It's been really, really striking to me that when confronted by the same data sets and the same recommendations from our national experts, that so many governments, some organizations, but certainly private citizens have drawn different conclusions. It's striking to me. It's in some cases aggravating. I do want to give credit to the state of Ohio and also the state of Illinois. Those are the two states that most closely follow the recommendations that came from the CDC, and we've had, despite being very, very large and populous states with plenty of exposure, we've done a good job keeping our economies going. We've had a better experience than many, and so I remain hopeful that through flu season in the winter that we can continue to have a great experience. This lack of testing is a really interesting one, right? Poor historians. That's a that's a great comment. This lack of testing is a big one, and it's interesting that we have so much manufacturing capacity, but when it comes time to distribute, when it comes time to set a national strategy, it's challenging. We as an industry are maybe not quite as built for that as we'd like to be. I think you're going to see some national stockpiles, some national coordination. I think you'll see some additional effort from governments, both on the federal level and on the state level. As I think about this and think about where we had our challenges, I think about on a personal level. So many citizens just failed to understand the science and take appropriate and consistent action. We often make decisions on headlines, not necessarily deep understanding. And I think back to, although I wasn't around for this, the debates between John Kennedy and Richard Nixon, their answers were oftentimes as long as 15 minutes. And that meant that the American electorate was paying attention to an argument or an answer for 15 minutes. And now in our debates, we limit candidates to 2 minutes. So really, we're trying to make decisions based on sound bites as opposed to deep levels of understanding. And I think that that's something that's particularly challenging. And that as healthcare professionals and leaders, we have an opportunity and more like an obligation to help drive better understanding through to the folks to the patients and consumers that we work with. Politically, we were uncoordinated, we were inefficient, we were ineffective. We all know that. That's not a partisan observation at all. We've seen good and bad experiences in states that were led by both parties. And then as a society, we've really let politics dominate the conversation. It was unfortunate. It hardened already deep divisions at so many levels, but even amongst friends and families. And then as a society, I'm also really concerned that we cannot predict the economic fallout of massive stimulus and a murky plan to end this pandemic. We've never seen anything like this before. We've never produced stimulus like this before. We've never printed this much money. And I'm concerned about that. I have been really, I think, excited and encouraged by what I've seen from a lot of large companies and employers, particularly in the pharmaceutical industry. They've taken risk on. Many large employers, hopefully many of yours as well, have made the strategic decision to keep all of their employees and to plow forward and to really stay committed to the people who help get them to this point with the confidence and the faith that they'll all succeed better together. So excited to see that. I want to ask you another question. So we'll flip this question around. Where did healthcare succeed during the pandemic? And so I'm going to go back to Slido again. Go ahead and stop the prior poll and start this one. Where do we succeed during the pandemic? Selflessness, absolutely. Commitment, being adaptable, preparation of the vaccines, absolutely. Resolve, focus, dedicated workers. Retooling, dedication to patients, determination to therapies. Absolutely. We had no idea how to treat this just a few months ago, right? Guidelines were flexible. Innovation. Totally agree. Perseverance, global cooperation. Yes, we did get back to a level of global cooperation that we've not seen for quite some time. Totally agree on that. Private sector cooperation, collaboration. All right, so we are seeing a lot of familiar themes here. and apologies that you're limited to, I think, 25 characters or so there. But so if you want to try and restate hopefully acknowledge that if you can summarize that in just a word or two, I'll keep this open for another moment. I want to comment on a few of these. Healthcare is still, more so than any other, it's a people business. We're not, while we're certainly relying on technology and hopeful that technology will take up a lot of the gaps that we have, we've got way too many physicians and nurses that we need, that we don't have a way to backfill. It's so much a people business, right? It comes down to the commitment of our people every day. It comes down to our decision making. There's no technology that would have saved us from this. Ultimately, it's still the people who make the decisions, still the people who who get face to face with patients under 3 layers of PPE to take care of them. And I also see provider collaboration here. Yes, so many. I mean, think about all the times all the time, effort, and money that providers expend competing over physician groups, competing for turf, competing for billboard space on the highway. We compete day in, day out. When it comes time to put that aside and collaborate, it's just fantastic. And I apologize here. I have to. There's an alarm going off in a different part of my house. Not a bad alarm, but just an alarm that needs to get turned off. So I need to send a quick message to have that turned off. I don't know if you can hear that, but I certainly can, and it's making me feel like I'm late for something other than this presentation. All right. So we really were, as we all knew, we were in a people business, and one that is so. There we go. One that is the most critical business in the U.S. We already know that it's. We already know that we're 18%, heading toward 19% of GDP. We're sort of the biggest, we're the longest pole in the tent of the American economy. But on a personal level, I completely agree. The sacrifices by caregivers and all of those to support them were just amazing. I thought that there were a lot of decisions that were made that were bold. I felt like the urgency of the pandemic forced some really smart and really necessary decisions, and we should be commended, and we should feel good about that. We should also carry that ability forward to make bold decisions, even when it's not a time of pandemic. Politically, there were some stages that really got it right. Ohio and Illinois did well. I mentioned those 2 states. Others did as well. As a society, also, we found a bit of compassion. We found a lot of compassion at times. We slowed down. We focused on family and friends. I go back to former coach at Ohio State, Jim Tressel's attitude of gratitude. You see that more in the people you work with every day. And there's been a softening and a refocusing on what really matters. So I thank you for your participation in that. I want to move forward a little bit as we start to look into the future. What did we learn? We learned a lot of things. One, our workforce, our workplaces are not as safe as we thought they were. Our workforce was already burned out, and they're in a worse place right now. So we've got a big challenge coming up. Every indication suggests that healthcare workers remain committed, but they're in a bad way right now. We already talked about the supply chain inefficiencies. We know about that. Also, a number of you mentioned the challenges of around data. We have a need to be proactive instead of reactive in the way that we deliver care. We have to have predictive analytics that work at the hospital and system level, as well as for individual patients. We also see this growth of telehealth and this desire for at-home personalized care. So many of us knew it was coming. So many of us supported it. It's here in a big way. And there's some emerging technologies that they're going to help support the growth of telehealth. And we frankly all need to hope that the policy and payment follow and support that. And then there's this need for digital transformation. We saw the advantage of those organizations that had already transformed. But if we think about the mom and pop stores trying to fight Amazon a few years ago, that's what it feels like to be an organization that has not digitally transformed and trying to compete with the likes of the leaders who are out there. We've also learned that one of the big underserved challenges of behavioral health and drug abuse has gone from bad to worse in this past year. So if we look at the annual increases in 2019 in anxiety, depression, substance abuse, and consideration of suicide, some of those numbers have doubled and tripled in terms of their year-over-year increases. So when we see numbers like these, we have to change the way we do behavioral health as a society. We have to really improve our focus and our collaboration across many different organizations to address these things. I've seen it in Ohio not too long ago when I was there. I saw people who had stopped at the gas station who were very clearly in their last days due to what looked to be methamphetamine addiction. It's frightening what's happened to people who've gone down those unfortunate paths. And this survey shows some really frightening results. On top of all these statistics, there was an increase of 32% for non-prescribed fentanyl, 20% for methamphetamine, 12.5% for heroin, and 10% for cocaine. Those are increases over the prior year from 2019 to 2020. That is unsustainable, and we all play a role there. And so when we consider more broadly the behavioral health in America, we don't treat it correctly right now. And those who aren't being treated right now should be treated. So youth mental health, this is incredibly concerning. Nearly 10% have severe major depression. My kids are young enough and fortunately healthy enough. We're not worried about that, but that number certainly got my attention. I'm sure many of you are more aware of that than I am based on your work or other circumstances. Even before COVID, the prevalence of mental illness among adults was increasing. 19% experienced some sort of a mental illness. So that's 1 in 5. Suicidal ideation among adults was increasing a bit. There is an unmet need for mental health treatment among youth and adults. 60% for youth and adults do not receive treatment for their mental health challenges. And we know that there is, just as we found that there was a cardiac or a vascular component to so many diseases 10 and 20 years ago that we had to treat. There is a behavioral health component underlying so many of the things that we have to treat. Very frequently, obesity, diabetes, et cetera, are not, those are not problems that we can just treat at the physical level. We have to get them at the emotional and the behavioral level. And the percentage of people with mental illness who are uninsured this past year increased for the first time since the Affordable Care Act. Nearly 11% of people with mental illness are uninsured right now. So I would posit that 50 years from now, we would want our kids and grandkids to look back and know that we work to advance the cause of behavioral health. When we look more broadly at the rest of the world, how we compare on basic health, the US versus the rest of the world, this is not news, unfortunately, but it's been brought into really sharp relief in these last few months. Our life expectancy at birth is remarkably low for a developed country. Infant mortality is the same. There are underlying political reasons for why that is happening. Frankly, a lot of folks who aren't covered or who are worried about being found out if they go for care. Some combination of that. I can share some more details and we can discuss that a little bit later on. The quality of our primary care is not what it could be in terms of how many people out there have unmanaged asthma or unmanaged diabetes. We're not doing a good job of identifying people who have these illnesses, and we're going to be in a bad way if we continue to let that continue. Our quality of acute care, both the U.S. and Canada, safety during childbirth is not what it should be. Our heart attack mortality is better than most, so that's good news. But we have a very uneven experience, and I would comment on a few of these things. One is we know that we spend more on healthcare than any other developed country, but our outcomes are generally not better. We don't spend on social care the way other similar countries do. So our total spend, if we consider social plus healthcare spending, is similar, but we're not getting the results that we could get because we're not doing all the things that we know. We're not addressing all the underlying issues of health. Healthcare spending is typically driven by utilization, but we in the U.S. defy this by using price as the primary driver of healthcare cost differences. So we spend up to $937 per person, or more than 4 times the global average on just administrative costs, truly middleman administrative costs that can go away. We have $1 trillion opportunity to take costs out of the industry. And perhaps the worst news that underlying all of this is that our younger generations are getting sicker much sooner. I'm a Gen Xer. The millennials who are coming up behind me, they are less healthy than my generation was at the same time. Last year, the Blue Cross Blue Shield Association concluded in one of their studies that millennials had a significantly higher incidence of 8 out of the top 10 health conditions, including depression, hypertension, hyperactivity, type 2 diabetes, and tobacco use. Those all showed the largest increases. So these findings, they reduce the quality of life and life expectancy for our younger generations. It's something we need to focus on. I can't imagine that history and our grandkids will judge us kindly if we don't do a better job addressing the health of the generations that are coming after us. Fundamentally, we've got some real challenges. So all of that is depressing and challenging. But we also know that as a society, both globally and on a national level, we've responded well before. And so as is often the case, we look back to challenging times and we look to leaders who have done incredible things. And in this case, I'm going to look back to Daniel Burnham, who was the architect who planned and rebuilt the city of Chicago after the Great Fire of 1873. He also planned and executed the Columbian Exposition a couple decades later, which really introduced Chicago to the world in the World's Fair. And he's perhaps best known by this quote, or parts of this quote, which was found after his death in a letter he wrote to a friend. "Make no little plans. They have no magic to stir one's blood and probably themselves will not be realized. Make big plans. Aim high and hope and work, remembering that a noble, logical diagram, once recorded, will never die. But long after we are gone, will be a living thing, asserting itself with ever-growing insistency. Remember that our children and grandchildren are going to do things that would stagger us. Let your watchword be order and your beacon beauty. Make no little plans. This is certainly no time for small plans." And when I reflect back on what Daniel Burnham shared, I think there are 3 big places that we need to have big plans. The first is in the area of equity. No matter who pays for what, we know we can and we should do better. There's no reason for poor health outcomes in the US with all the vast resources and technology that we have. Efficiency, I mentioned it before. We have $1 trillion in waste in the current system. New systems, new process improvements are going to bring more efficiency, but just in the system we have right now, there's $1 trillion that can come out. There will be some tough decisions because for decades, everyone has won. Every one of the major stakeholders has won in healthcare in the US. But whether you're a health system that's making a 3% margin, or a device manufacturer that's making a 30% margin, or a software manufacturer that's making a 40% margin, not everyone is going to win when it comes time to take those dollars out. And that's going to be a tough pill to swallow, but it's something that's happened in every other industry as it's moved to become digital. And finally, in terms of effectiveness, we are thinking right now about bots and robots and different types of existing technologies that will make us effective, but also encourage us to think about genomics and therapeutics. Think if we didn't have to guess and follow the formulary and the flow chart as to which therapeutic is going to work. Think if we could just say, based on your genes, Donna, you're taking this pill, and Rob, you have the same condition, but based on your genes, you're going to get this pill. And we know with a high degree of accuracy, these are going to work. That will fundamentally change the way that we deliver healthcare. We need to, and a lot of companies are running in that direction. So we talk about equity, and I alluded to this earlier, but Healthbox has created a partnership with the Parkland Center for Clinical Innovation, which, if you're not familiar, is the analytics firm focused on social determinants that spun out of the Parkland Hospital and Health Center, which is effectively the county hospital for Dallas. And this was something that was born out of need. Like all county hospitals, there were significant problems with social determinants, and PCCI built a lightweight but very robust set of analytics tools and important partnerships with dozens of organizations across Dallas to drive some pretty dramatic changes in the way that the care is delivered, particularly to the most vulnerable. They're actually able to do it in ways that make a lot of sense financially, that do drive a return while still protecting those who are the most vulnerable in the society. If you're interested in that, please do reach out to me. I'd be happy to get you connected with the folks on my team and at PCCI who are involved there. But when I started my career, 20 some years ago, it was all about technology. It was an arms race. It was all about devices. Who had the best stent? Who had the best CT scanner? It was about new pharma, new pills that were coming out, and so much more. So it was all about the tech. About halfway through my career, we started to shift to systems of care. Right? It was about moving care from the highest cost inpatient areas to ambulatory settings. It was about changing the systems and really a focus on getting the process right and getting efficiencies out of the system to both improve care and to improve margin. Now we're moving to a scenario where it's really about systems of community. We know that the underlying non-medical needs that ultimately drive health outcomes are where we need to focus. It's not the only place we need to focus, but it's a place that we need significant focus if we're really going to drive good outcomes. So we know and we can act on those root causes of health. And we also know not only does zip code matter more than your genetic code, but we can address individuals and individual blocks and people within a zip code differently to drive better health outcomes. So in terms of equity, I'm really encouraged by what we see there. In terms of efficiency, we're actually not too far off from the expectations we had when we were kids. All right. We've got robots doing more and more work for us, right? Not quite bringing us our shoes, but doing a lot of things professionally that we need to have done. And so I would look to artificial intelligence, to virtual reality. These emerging technologies which have been emerging for quite some time, will become ubiquitous, and we'll see some of those more insightful decisions and less risk-averse decisions are going to bring those on board. We're not quite there on the flying cars, although I do have a close friend and former colleague who went to work for one of those companies last year. So knowing him, if he went, we're getting closer. But so many of the things that we can only imagine in our daily life and in the industry have really come to fruition. So I'm going to go to one last poll before we wrap things up and get on to Q&A. What healthcare technology would you most like to see in the future? And let me kick off that poll. There we go. What would you most like to see? Well, the first two answers, IoT. I love it. Telehealth, not too surprising. And I would share that I think telehealth, great follow. I was just about to say that telehealth and at-home devices, the increase, the proliferation of consumer grade, so inexpensive, not enterprise grade devices is going to be significant. Precision medicine, genomics, passive monitoring, absolutely. Incidentally, there are a number of companies involved in passive monitoring, care at home and at-home devices that were in pilot, that we're starting to see that frankly, had they been at scale, could have picked up on COVID in nursing homes had they been in place. So we were literally just a few months away from being able to pick up COVID on our own without having to be notified of what was going on in China. Predictive analytics, improved wearables, absolutely. Device interfaces with EHRs, that is certainly a big one. Lower healthcare costs, that is a goal that we must all embrace. I would say if what we're doing is not in line with driving out cost, we're on the wrong side of probably on the wrong side of the CFO's decision line, and certainly on the wrong side of history as well. Consolidated patient records. I'd love to see consolidated and portable patient records. We have that technology. A universal patient record, absolutely. Expanded tech in the rural community. A couple things to get really excited about there. I would say that that all of the if you look at what SpaceX has done, they have 900 satellites that are mostly focused on the U.S. markets right now to bring broadband to every inch of the U.S. At a relatively low cost. I think that's what gets us to expanding tech in the rural community. And then true interoperability, absolutely. To some extent, this has to be legislated, but it's something that certainly all of you know, many of you are aware of and live that every day, right? So I love your answers, and I very much appreciate your engagement. So a couple of things that I think we're going to continue to see. And that we need to have if we're going to be judged well by history. One is the shift to home. So many of us, have already moved to home in whole or in part, but our kids have moved home in a lot of ways too, right? They're looking at the same screens and the same Zoom. My kindergartner has spent plenty of time on Zoom with his classmates. This shift to home and this recentering around the home is something that I think is going to be a net benefit. That our kids and our grandkids are really going to appreciate. So we'll see how it all plays out. But being connected to a big world and being and still having home be where we are and what we do is so important. It also supports sustainability in an interesting way. When we're not commuting, nature has a chance to come back. Right? There's less pollution than there was at this time last year. And I don't know about you, but I've noticed in my backyard, more birds, foxes, opossums, animals we hadn't seen either before or in a long time, they're back. And I'm not sure if that correlates. I'm not sure if I'm just home more and see them more now, or if nature is truly doing better. But some governments, including the Dutch government, is actually using the pandemic as the leverage to demand that we move more care to the home to support sustainability, so that patients and physicians aren't commuting as much as they once were. So keep an eye on that. I think that long term, that sustainability that can be driven in part by our industry will be a big one. Also, I used to spend at least a third of my time in and out of airports and away from home. I'm really happy that I think the new normal will be that we'll travel occasionally and not constantly or not routinely. We're more efficient in the ways that we work. We're more efficient using Zoom and WebEx and all the other platforms that we have. And this efficiency can help us deliver strong, healthy families, which is really the foundation on which we'll build for the future. So I thank you for this opportunity. I'm really thrilled to get the chance to come back. I would love, and Alex, you can tell me how we want to do this if it's via the chat. Be happy to spend a few minutes on any questions you might have, and would love for any of you to reach out if you'd like to hear more about what we're doing in social determinants, or to continue the conversation in any way. Thank you.
Yeah, Justin, thank you so much. I appreciate that. You covered quite a bit of ground here, and so and it was fabulous. The downside to having a virtual conference is you don't hear the round of applause here at the end. So I want to thank you again for spending time with us. I did notice that there were some Q&A posted there in your online chat. So I'll read a couple of those if we've got just a couple minutes before we switch over here.
Sure.
Did we learn anything from the Spanish flu, SARS, or other epidemics that we think might apply now? And did they do any type of memoirs like we're talking about here for us to learn from?
Great question. And I'm not, I may not be the best position for that. I think so much of what happened with the Spanish flu, so many of those lessons were simple lessons that we're just having a hard time applying right now. Things like wearing masks, right? Which you would think is like it's certainly all of us who work in healthcare. I mean, many of us who've spent time in clinical areas wore masks for hours at a time, right? For 8 and 12-hour shifts in some cases. So simple things like that, were the really easy lessons. I think the other thing that we did learn too is that at the same time that the Spanish flu was happening, we were also winding down World War II. And President Wilson actually got the Spanish flu and was sick for a few days while he was trying to negotiate the treaty when he was over in Paris. So it's I think the big lessons were the obvious ones that we're trying to drive home right now, right? And that we are in this global and interconnected world that we weren't in back then. So we have all the opportunities that technology and a more free society provides. So the lessons, quite frankly, from the Spanish flu were the obvious ones. You can't have, you have to have strong leadership and everyone rowing the same direction and caring about each other in order to reduce the transmission. So no surprising lessons out of that one. In terms of memoirs, I'm sure there are some that are more they're more clinical in nature. But so much of the history that came out at that time was more focused around winding down the World War and in a lot of cases, the responses to the Spanish flu was more about we didn't have vaccines back then, right? We were waiting for it to run its course and to get to a level of herd immunity, unfortunately.
No, that's great. I appreciate that. Yeah, and hopefully we never have another one, but if we do, I hope we're much more prepared learning from this one.
Yep.
Another question is, do you see telehealth and medical home devices being used to treat a higher level of care patient in a home health setting, freeing up hospital beds?
Absolutely. We're seeing significant investment by companies large and small. I think you're going to see at Walgreens and Rite Aid and CVS and Best Buy, you're going to see products very, very quickly that address all that. So I know of I'm familiar with a number of companies that are doing that. I would expect even your cable providers to get into that business in a big way and to have offerings that are coming very soon. Those things were all in the planning stages prior to the pandemic. And like so many other things, got accelerated by the pandemic because we see if we had these things out 6 or 12 months earlier, what the impact that we could have made.
Yeah, agreed. And final question, I think, is unless anybody else has anything they want to put in the Q&A, I think many of us are focused particularly in our regional efforts, but are there opportunities for us to learn from kind of broader, even other countries, what's going well, what's not going well, and how do we share that information and learn from each other? It's great to look at this as a regional, endeavor, but how do we also learn across the whole globe how to prevent something like this?
That's such a great question. We could spend a few more hours on that one, but I'll summarize. And I'm mostly sharing what I learned from Dr. Charles Alessi, who's the Chief Clinical Officer for HIMSS. He lives over in London. He spent his 40-year career in much of it as an advisor to the World Health Organization. He's a top advisor at NHS. His observation, as he's been involved in the worldwide response to the pandemic, is that other countries that had a tougher go of it with the prior pandemics, swine flu, Ebola, they were prepared, even when they had and every one of them had less sophisticated healthcare systems than what the U.S. has, but they had learned those hard lessons, and they had those things in place. They were countries that were far ahead, that knew how and when to quarantine. They were willing to make the tough decisions more quickly because they've been through it. So there's a ton to learn just by experience is the best teacher, unfortunately. And while we've I think tried to apply a lot of those same things, I think we've done a good job of identifying those things. Maybe an uneven job of applying those lessons. but those lessons are all out there. And it's important also to note that the World Health Organization, while I don't know if it has a science problem, it has had a public relations problem during this pandemic at times. The World Health Organization enjoys a very, very close relationship with the Centers for Disease Control. And in a number of those pandemics, it was scientists from the CDC in the US who were brought in to help augment and really support the WHO. So the US has a leadership position in that science, in the science and in the response to pandemics and other major health threats. And I don't see that changing moving forward. I do see what's changing for us or what will change for us is that we'll take those lessons and act on them more quickly moving forward.
Yeah, I hope so, right? We're all learning how to go at a different pace, aren't we?
We certainly are. And that's a good thing for our industry, right?
Making up some lost ground.
Yep, you bet.
All right, I don't see any other questions here. So, and I know we are about 4 minutes to the top of the hour. So Justin, I truly want to thank you for joining us this morning and sharing your thoughts. Great to see some perspective going across, all of that. So, you covered quite some from a time range and from a geography range. So thank you again for your insights, and hopefully we learn and keep going better, faster.
You bet. Alex, thanks so much. It was my pleasure. I appreciate the opportunity.
All right. Thanks again.